Welcome to the Deep Dive. Today, we're getting into a really important topic for anyone with pets, primary bone fibrosarcoma, or FSA, in dogs and cats.
Mhm.
We're using a detailed veterinary resource on diagnosis and treatment, and, well, our mission is to break down the key info so you can understand this cancer, even if you don't have a vet background.
Right.
We'll look at what it is, how it shows up, and, how vets are currently tackling it.
Okay, so let's dive right in. Primary bone fibrosarcoma, it's basically a cancer starting in the connective tissue cells inside the bone marrow.
Connective tissue cells, okay.
Yeah, and what's really specific about these cells, these malignant spindle cells, is that they produce collagen, that structural protein.
Right.
But crucially, they don't make actual bone or cartilage tissue. It's sort of like a factory gone wrong, just churning out collagen fibers within the bone.
Okay, that makes sense. So thinking about dogs and cats, how often does this actually pop up? Is it common?
Well, that's a key difference, actually. For dogs, primary bone FSA is relatively rare. The resource says less than 5% of all primary bone tumors, so not super common in dogs.
Less than 5%. Got it.
But then you look at cats, and it's a different story. It's reported as the second most frequent bone tumor in cats.
Wow, second most. That's quite a jump.
It really is a pretty significant difference. The resource doesn't spell out exactly why, but yeah, definitely more of a concern for cat owners, relatively speaking.
Okay. So if it does happen, where are we most likely to find these tumors?
In dogs, it's typically the long bones, in the legs, specifically often near the joints in the metaphysis or sometimes in the main shaft, the diaphysis. Pretty consistent there.
Legs, okay. And cats, you said they were different.
Yeah, cats show more variety. Still can be long bones, but you also see FSA in places like the jaw bones, upper or lower the humerus, that's the upper arm bone, shoulder blade, the scapula, the wrist bones, even the toes, and also ribs, the sacrum, which is the tailbone area, so it's much more spread out location-wise in cats.
Good to know, especially if you find a lump somewhere unexpected on your cat. What about age? Any typical age groups?
Yeah, there are some general ranges. Dogs, it's quite broad, like 1.5 years old all the way up to 12 years.
Big range.
It is. Cats tend to be diagnosed when they're older, usually between 9 and 13 years old.
Okay, so generally older cats.
Generally, yeah. And interestingly, the resource makes a point of saying there's no specific breed or gender link found for either dogs or cats with this primary bone FSA.
Huh. Okay, so it can affect pretty much any older cat or dog across a wider age range.
Seems that way based on this.
All right, so we know what it is, roughly how common, where it might be, and who gets it. Let's talk about signs. What might an owner actually see? For a dog with it in a leg, for instance.
Okay, so for limb FSA in dogs, the big one is usually lameness, limping, and often it's progressive, meaning it gets worse over time.
Gradually worse.
Yeah, but sometimes it can be really sudden. That can happen if the tumor weakens the bone so much that it just breaks. That's called a pathologic fracture.
Ouch.
Yeah, and owners might also just feel a lump or swelling on the leg.
Makes sense. What about those other locations, the axial tumors not in the limbs? What signs pop up there in dogs or cats?
For those axial sites, localized swelling is common, maybe with some pain if you touch it, but the other signs really depend on where exactly it is.
Like what?
Well, like jaw tumors, they can cause really bad breath halitosis or trouble swallowing, maybe pain when opening the mouth, even nasal discharge sometimes.
Okay.
If it's in the spine, the vertebrae, you can get neurological issues from the tumor pressing on the spinal cord, weakness, wobbliness.
Serious stuff.
Definitely. Rib tumors, interestingly, usually don't cause breathing problems unless they get absolutely huge and start physically crowding the lungs.
Right. Okay, that gives a good range of possibilities. So the owner brings the pet in with these signs. What does the vet typically find on the physical exam?
So for a dog with limb FSA, the exam will likely show that lameness we talked about could be mild, could be completely non-weight bearing, and often you can feel that swelling, that mass on the bone. For the axial tumors, it's more variable. Sometimes you can see or feel a mass, but if it's deep inside, like in the pelvis or spine, it might not be obvious just from the physical exam. Depends on the size and location.
So the signs can point towards it, But it sounds like it's not always a slam dunk diagnosis based on symptoms alone. Other things could look similar.
Exactly. That's the diagnostic challenge right there.
Mm-hmm.
Lameness, swelling, so many things can cause that. Vets have to consider a whole list of possibilities.
And the resource lists quite a few of those other possibilities, right?
Okay.
What kind of things are on that differential diagnosis list?
Oh, yeah. It's pretty extensive. You've got other primary bone cancers like osteosarcoma, which is actually more common than FSA, chondrosarcoma, hemangiosarcoma.
Okay, other bone cancers.
Then there's metastatic cancer, so cancer that started somewhere else, like the bladder, prostate, mammary glands, thyroid, even anal sacs, and then spread to the bone.
Right, spread from somewhere else.
Exactly. Also, tumors near the bone that grow into it, like from the nose, mouth, soft tissues in the toe, or even other types of fibrosarcoma nearby.
Okay.
And then you've got things like blood cancers, myeloma, lymphoma, which can sometimes involve bone, and finally bone infections. Bacterial or fungal infections can definitely mimic cancer on x-rays sometimes.
Wow, okay. That's a lot to rule out. So where do vets start? What are the initial tests?
Well, interestingly, standard blood work and a urinalysis, they're usually normal with primary bone FSA.
Oh, really? So not that helpful.
Not specifically for diagnosing FSA, no. They're still important for checking overall health, organ function, ruling out other systemic problems, but they won't typically flag the FSA itself.
Okay, so if blood tests aren't the key, I'm guessing imaging is crucial.
Absolutely. Imaging is where you start to really see what's going on in the bone. X-rays of the affected area are usually the first step.
And what do they show?
They can show aggressive signs, things like bone destruction, that's lysis, or thinning and damage to the outer layer, the cortex. You might see weird patterns of new bone being laid down, and often the edges of the tumor are really poorly defined, fuzzy.
Okay, so suggestive signs on X-ray.
Definitely suggestive of something aggressive. And crucially, chest x-rays are almost always done at the same time.
To check for spread.
Exactly, to look for pulmonary metastasis, spread to the lungs, which is unfortunately a common place for bone cancers to go.
Right. What about more advanced imaging, like CT scans? When do those come in?
CT scans are really recommended for those axial tumors, spine, pelvis, skull, ribs. They give a much, much more detailed 3D picture.
Why is that so important there?
It's invaluable for seeing the exact extent of the tumor and how it relates to vital structures nearby. This is absolutely critical if you're planning surgery or radiation therapy in those complex areas. You need a precise map.
Makes sense. So imaging gives strong clues, but how do you get that 100% confirmed diagnosis of FSA?
Right. For definitive confirmation, you need a biopsy. A small piece of the abnormal tissue is taken.
And sent to a lab.
Exactly. Sent for histopathology. A pathologist looks at it under the microscope. They're looking for those specific malignant spindle cells, confirming they're making collagen, but not bone or cartilage. That's what confirms it's FSA and not, say, osteosarcoma.
The biopsy is the gold standard then.
It is.
So once FSA is confirmed, is that it? Or do you need to look for spread elsewhere, beyond the lungs?
Good question. Yes, you definitely need to consider metastasis beyond just the initial chest x-rays. This resource mentions FSA can spread to nearby lymph nodes, other bones, even the skin, the sac around the heart, the pericardium, and the heart muscle itself.
Wow, lots of potential places.
Yeah. So depending on the case, maybe the initial findings, further tests might be needed, like sampling lymph nodes or doing more advanced imaging of other body parts to fully stage the cancer.
Okay, so diagnosis is sorted. Let's switch to managing it. For tumors in a limb, what's the main treatment?
For limb FSA, the standard recommendation is typically amputation of that limb.
Amputation, okay.
Yeah, it sounds drastic, but it's often the best way to remove the entire tumor locally and also get rid of the source of pain.
Right. And what about those axial tumors, the ones in the spine or jaw, etc.? Surgery must be trickier there.
It definitely can be. The goal is still wide surgical removal if at all possible, getting the tumor out with clean margins of healthy tissue around it.
But if you can't get it all?
If complete removal isn't feasible because of the location, then radiation therapy after surgery might be recommended to try and kill off any remaining microscopic cancer cells and improve local control.
Radiation, okay.
And the resource also mentions stereotactic radiation therapy, or SRT. It's a more focused type of radiation that's shown good results for other bone cancers in dogs, and it might be an option for FSA in some of these tricky axial spots, too.
Interesting. What if surgery just isn't an option at all? Maybe the tumor's too advanced or the owner decides against major surgery?
Yeah, in those situations, the focus shifts to palliative care, basically managing pain and maintaining the best possible quality of life for the pet.
how do you manage the pain? What medications help?
There's a few options. Non-steroidal anti-inflammatories, NSAIDs, are common. Other pain meds like tramadol or gabapentin can be added.
Mm,
And there's also a class of drugs called bisphosphonates, like pamidronate or zolidronate. They're given intravenously and can specifically help reduce bone pain and slow down the bone destruction caused by the tumor.
okay, pain management is key. What about chemotherapy? Does that play a role?
It's a bit less clear-cut for FSA compared to, say, osteosarcoma.
Hmm.
The resource notes that using chemo after surgery, adjuvant chemo, hasn't been fully evaluated specifically for FSA in large studies.
So maybe?
Maybe. Because there is that risk of metastasis, chemo might still be considered, often using a drug called doxorubicin, maybe combined with others like cisplatin or carboplatin. But it's really crucial to talk to a veterinary oncologist for the latest thinking and whether it's appropriate for a specific case.
Got it. So consult an oncologist. After treatment, whatever that involves, what kind of follow-up is needed?
Regular checkups are really important. Physical exams and chest x-rays every 2 to 3 months are typically recommended.
Looking for recurrence or spread again?
Exactly. Monitoring for any signs of the tumor coming back locally or spreading elsewhere, especially to the lungs.
Okay. And the big question for owners, what's the prognosis generally like for dogs and cats with this?
The long-term outlook is often described as somewhat guarded or uncertain. There's just less specific data on FSA compared to other bone cancers.
So hard to give firm numbers.
A bit. We know that getting complete surgical removal of the main tumor gives the best shot at long-term control. But, and this is a big but, even with successful surgery, maybe up to half of these patients might still develop metastasis later on.
Up to half.
Yeah, and sometimes it can pop up quite late. The resource mentions metastasis being found even 19 months after an amputation in some cases, so that just reinforces why that ongoing monitoring is so vital.
Definitely. Okay, so let's recap this deep dive. We've explored primary bone fibrosarcoma starting in connective tissue, causing varied signs like lameness or swelling depending on location. Diagnosis relies heavily on imaging and ultimately biopsy.
Right.
Treatment often involves surgery, like amputation for limbs or wide excision for axial sites, potentially with radiation. Chemo's role is still being defined, and that risk of metastasis, even late metastasis, is a significant concern.
Absolutely. And, thinking about that challenge metastasis happening even after aggressive local treatment, it really makes you wonder, and maybe this is something for you, the listener, to ponder. What's next? With veterinary oncology always advancing, what kind of breakthroughs, maybe in targeted therapies that specifically hit FSA cells, or perhaps much earlier detection of tiny amounts of spread, could really shift the odds for pets facing this?
Yeah.
It really highlights that ongoing search for better ways to fight these tough cancers and improve outcomes for our animals.